I'm Mark Stober. I'm mayor of the city of Cold Spring, and I have been thrilled with the conference today. I'm amazingly surprised and pleased with the General Electric Corporation. The corporation is so large and so diverse, but they truly understand healthcare, they truly understand wellness, and they truly understand that the power for wellness and healthcare truly is at the individual level and the person level, and they've committed significant resources to it, and I'm just absolutely thrilled with that. Dr. Rosen, I had not heard him speak before. High energy. I put him in the world of the Zig Ziglar of healthcare. He energizes you. His statistics are amazing, and it's the first time I've ever heard truly where genes, the genomes within our DNA, actually we can influence them. I had not, so many people say we're predisposed based on our DNA, but he actually proved that we could influence them, and I'm just thrilled about that. That is absolutely, totally new information for me. So it's been wonderful.
Jennifer Elsperman from Coljet. I'm the HR manager. At the conference today, I heard a lot of things I expected to hear, and I got some great ideas of things that I hadn't heard before. The biggest thing that hit me as an aha moment today was that stress is a serious contributor to a lack of wellness, to chronic disease, and that the stress inherent in our corporate cultures, the stress that our employees face in terms of being caregivers to their children and their parents and in their work-life balance, affects their health and well-being, and in turn their chronic illness and our costs on our healthcare program. So one of the easiest ways that we can promote our employees' health is by providing an environment that has a reasonable degree of workplace health and that has flexibility that allow our employees to take care of their families.
I'm the CFO with StoraPack, which is a North American subsidiary of German-owned business. I personally am very fired up after being here all day. I think this is the second kind of major conference that I've been to this month on wellness. It's something that's very important to our business this year. We need this stuff, and I've got some great ideas from the presenters and from other colleagues about how to get started and the kind of things that we can do to ensure success, at least in the initial stages. I think it was great. I think it was well done. I think it's perfect timing, great subject, well coordinated. And I also want to say that it's great that you had healthy stuff here. Actually, the last conference that I went to on wellness, they had really bad breakfast food. They had sausage and bacon and all kinds of stuff, and it sends a message. Just what you had available for snacks and food and stuff really sends a message. I think it's the right thing to do. It's a cultural issue in the United States, the problem we're dealing with, and I think every little thing that we do sends a message to our people and to our community. I think it's right on. Well done.
I'm the CFO for My Intelligence Inc. And I came to the conference to see if there was any way that we could reduce our healthcare costs. We're a self-insured healthcare plan, and wanted to see if there's any wellness programs that might have a near-term impact on health costs. And what I really took away was any investment in healthcare wellness programs is probably a longer-term benefit. Still worth considering, but something that's not likely to have an immediate return on investment.
John Lindeman. I'm the Senior Manager of Human Resources for Rubia Inc. We're an automotive supplier based in Northern Kentucky. I came to the conference today for really two reasons. One is I am presenting on the local initiatives, and particularly on our No Tobacco initiative that we started in Rubia back in November. But this was also an opportunity for me to meet other individuals who were involved in the wellness program. As one of the presenters earlier said, this tends to devolve on human resources. Not having had a lot of prior experience in this area, in seeing the panel, I could see there were some real experts on it, and I've probably come away from this with 7 or 8 really good ideas to look at today as we move forward with our wellness program.
My name is Connie Rutherford. I'm the Director of Compensation and Benefits at Standard Textile here in Cincinnati. Our company is very, very focused on wellness, and I think it was good today to hear some of the metrics that some other companies are using and helping them measure how effective their wellness programs are. Everyone said today is really going to help us in taking some of these ideas back and improving our company, and improving the things that we can offer our associates, because I mean, I think it was important when I heard you've got to make sure you provide the resources to your associates. Once you identify your issues, you have to know you've got the resources, because you can't ask them to change unless you're there to help them, and also ways to help motivate them. So I think everything about this was very, very helpful for our company, because I mean, wellness is definitely one of our top priorities.
Clasp your hands together, just reach. This also opens up those core muscles, stomach muscles, muscles around your ribs, those, opening up that area in the upper back.